Hello, future nurses. Today we are going to simplify one of the most tested topics on the NClEX, acid-base balance. If ABGs confuse you, don't worry. By the end of this video, you will understand acidosis versus alkalosis. Know respiratory versus metabolic. Interpret ABGs step by step. Apply it in clinical scenarios. Let's begin. Step 1. Know your normal values. Before interpretation, memorize these. Normal pH: 735 to 745. Normal CO2: 35 to 45 mmg. Normal HCO3- bicarbonate: 22 to 26 milliequivalent per liter. Without these numbers, you cannot answer NClEX questions correctly. Step 2. Understand the pH first. Always look at pH first. If pH is less than 7.35, acidosis. If pH is greater than 7.45, alkalosis. Example: pH 7.30. This is acidosis. pH 7.50. This is alkalosis. Simple. Step 3. Is it respiratory or metabolic? Now ask. Is the problem coming from the lungs, CO2, or the kidneys, HCO3? Remember, CO2 is controlled by the lungs. HCO3 is controlled by the kidneys. Respiratory imbalances, CO2 problem. CO2 is an acid. If CO2 increases, pH decreases, acidosis. If CO2 decreases, pH increases, alkalosis. Respiratory acidosis. Cause: hypoventilation. Common situations: COPD, opioid overdose, sedation, airway obstruction. Clinical signs: slow breathing, confusion, drowsiness. Example ABG: pH 7.29, CO2 52. Interpretation: respiratory acidosis, respiratory alkalosis. Cause: hyperventilation. Common causes: anxiety, pain, fever, early sepsis. Example ABG: pH 7.48, CO2 30. Interpretation: respiratory alkalosis, metabolic imbalances, HCO3 problem. Bicarbonate is a base. If HCO3 decreases, acidosis. If HCO3 increases, alkalosis. Metabolic acidosis. Causes: diabetic ketoacidosis, DKA, renal failure, severe diarrhea, lactic acidosis. Classic sign: small respirations, deep rapid breathing. Example ABG. pH 7.28. HCO3 18. Interpretation. Metabolic acidosis. Metabolic alkalosis. Causes: vomiting, NG suction, diuretics, excess antacids. Signs: muscle cramps, weakness, hypokalemia. Example ABG. pH 7.49. HCO3 30. Interpretation. Metabolic alkalosis. The easiest NClEX trick. Rome. Rome means Rome. Respiratory opposite. Metabolic equal. If pH and CO2 move in opposite directions, respiratory. If pH and HCO3 move in same direction, metabolic. Example: pH down, CO2 up, opposite direction. Respiratory acidosis. Example: pH up, HCO3 up, same direction. Metabolic alkalosis. This trick alone helps answer many NClEX questions. Clinical thinking for nurses. When you see slow respirations, think respiratory acidosis. Hyperventilation, think respiratory alkalosis. Severe diarrhea, think metabolic acidosis. Vomiting, think metabolic alkalosis. Always connect the condition to the imbalance. NClEX tests application, not memorization. Rapid final review. pH below 7.35 equals acidosis. pH above 7.45 equals alkalosis. CO2 problem equals respiratory. HCO3 problem equals metabolic. Low breathing equals respiratory acidosis. Fast breathing equals respiratory alkalosis. Diarrhea equals metabolic acidosis. Vomiting equals metabolic alkalosis. Acid-base balance does not have to be complicated. Focus on pH, CO2, HCO3, Rome. Practice consistently, and ABGs will become one of your strongest topics. If this helped you, make sure to subscribe for more simple, clear nursing lessons designed for NClEX success. See you in the next class.
Hey!